I'll start out with maybe a briefer version of that introduction while we're waiting for Representative Murphy to join the call. But Jim and I thought best to get together with IPC members and give an update on your Wisconsin government relations platform. Been a successful session, and wanted to talk about just an overview of what's happened and where we want to go with the membership and how we can get engaged in the summer as legislators hit the campaign trail and want to be able to be involved and engaged and make a bigger impact yet in the next session. A couple things that we're going to look at, and we'll wait for Representative Murphy to come on. He's very important to us, especially right now, because he was the author of the bill that became Wisconsin Act 98, and that is the provider or pharmacist services reimbursement bill. Mark and Jim, maybe when we get into the presentation, will shed some light on that. But it's a great opportunity, backed by IPC and PSW and others in the state of Wisconsin, that's going to allow new service and revenue opportunities for our members. So very, very excited about that. And also want to touch on some of the other pharmacy-related and healthcare-related bills that are moving through the legislature. And then get into a little bit of a session overview. We'll give you a preview of what's coming this summer. And if you're a Brewers fan or wherever you are, get used to seeing the political commercials, because Wisconsin, as we approach this midterm election, is going to be in a real battleground especially in the governor's race and in the U.S. Senate. We'll preview that a little bit, but I'm sensitive to not spending too much time on election coverage, because I think we've now entered constant election coverage every time we turn on the TV. And then we'll talk at the end. We want to wrap it up, talk about IPC membership next steps and what your voice means to a legislator. We'll ask Representative Murphy that same question as well. But excited about what we've been able to accomplish in a short time, and where we want to go to increase IPC's membership's voice in Wisconsin to help continue to improve the regulatory landscape for you all. So that being said, if Jim or Mark, anything to add to that while we wait for Representative Murphy to join?
Nick, I just want to say that I also felt it was a very successful year. In more specifics around Act 98, but that's to be provider status and getting pharmacists paid for consultation and services, sometimes under the medical benefit, not just the pharmacy benefit. We're seeing that momentum carry across the country, and Wisconsin's certainly out in front of it. And we're borrowing from some of the things that we learned there, and I think it's created great precedent. Now, if we can show that it improves outcomes and saves money, which I certainly believe it will, we'll have a great opportunity to expand on that program into other areas other than just the Medicaid program.
That's great. And while we're waiting, I think I'll just we can maybe give an overview of Act 98, so everyone on the call can get a better picture of what we're looking at. So the Wisconsin Act 98, and just as Mark described, it's for reimbursement under the MA program for pharmacist services. Oh, I thought we had some change there. I thought Representative Murphy was on.
There he is.
Oh, Michael.
Hi guys, I have Representative Murphy now.
Oh, great. All right.
Just turn the volume up for you.
All right.
There he is.
Hello there.
Representative Murphy, great to see you tonight, and thank you for bearing with us with rescheduling on you. We were able to move it up to 5:30, so I hope that works out a little better for you.
Yes, just a lot of stuff going on. Sorry, I'm a little bit late getting to this myself tonight. So I I guess we're even.
Yeah, I guess we're even. Uh, so, Representative Murphy, I'd just like to introduce you to the Independent Pharmacy Cooperative team.
Hey, guys.
On the phone, we've got Mark Kinney, and Mark, give me a new title. He's state government relations nationwide for IPC.
Oh, wow.
Correct. Thank you, Representative, for joining us tonight. It's very much appreciated.
And we've got Jim Driscoll, who's similarly is works for IPC in different states under Mark Kinney. And then we've got Tanner and a few others from IPC headquarters in Sun Prairie, Wisconsin here. And then we've got several members,
Okay.
independent pharmacy owners on the call as well. And so we're excited to have you on the call. And what we've just been talking about is Wisconsin Act 98. So we'll get into that in just a little bit. But an introduction for Representative Murphy, truly one of the good guys in the Capitol. We've worked together. Well, it's been a long time, and we worked together when I was working on university policy quite often. You're the chairman of the Colleges and Universities Committee in the Assembly, and have a hearing coming up pretty quick here at noon tomorrow. Is that right?
Exactly. Yes.
But he's a former small business owner, and he's currently kind of the patron saint of independent pharmacists who are excited about Wisconsin Act 98. So, Representative Murphy, thank you again, and I suppose I'll tee you up for maybe an overview on Act 98, and what you kind of see in that bill, and we'll talk maybe about what you see kind of as the session wraps up in the next month.
Well, as you know, Nick, it certainly is the busy time of year, and yeah, we're trying to get as much done as we can before the end of session. And I always tell myself that next session somehow we're gonna figure out a way not to make the end as crazy as it is, but that never changes. And I don't know. I guess it's the whole idea of deadlines makes everybody work harder, and so that's sort of where we're at. I'm very honored to be able to work with the pharmacies and the Pharmacists Association to get the bill passed. Going into this session as a Republican with a Democratic governor, you don't think you're going to get very many bills passed, and I've been lucky enough to get two of them in the pharmacy area passed this time, and so I'm pretty happy about that. I did introduce a bill this last week, and I sort of hesitate to bring it up because I don't know how everybody feels about that. And it's the dispensing bill. It requires pharmacists to dispense with a doctor's prescription, and I just kind of wanted to let people know about that because I want them to understand where I'm coming from on that piece of legislation. And there was an issue. There's been an issue in the Fox Valley where I live with prescriptions not being filled, and I've had pharmacists tell me that there are federal regulators that are watching them, and they're not comfortable with filling some prescriptions. And so the idea wasn't so much to force pharmacists to do something; it was to give them some cover when they do something that some regulator isn't going to be able to come in and say, well, why did you do this? Because the law says I need to do that. I need to fill this doctor's prescription. So anyway, I kind of got off track of maybe, Nick, where you were looking to go, but I did want to let you know that.
Aware of that bill, I chatted with my counterpart Danielle over at PSW a little bit, and
Okay.
we'll be happy to send that out to our group to evaluate and get our perspective and information back on that. But really wanted just kind of steering back to Act 98, the reimbursement for pharmacist services, really important bill. Especially given, as you are aware, all the added value in the healthcare space that pharmacists do at the local level for everyone that comes into their store. So really, really a big step in the right direction from our perspective, and just wanted to hear what kind of benefits are and input did you get from pharmacists in your community?
Well, I think the big thing, Nick, was when you look at that legislation. So I serve on the health committee, and one of the things that I said to myself when I went on that committee is my goal was to make healthcare less expensive for the people of Wisconsin. And every bill that comes before me, I look at, through that lens. And on that particular bill, we were looking at saving people as much as $1,000 a year in their cost by being able to access pharmacists to be able to do some of these functions under Medicaid that that they weren't allowing. And so it's a big step forward in being able to do that and to cut people's costs. And let's face it, these are things that otherwise pharmacists, are allowed to do. So, I mean, they're within your scope of practice. There's no reason why we shouldn't be doing that.
Well, I know we all feel the same way, and Mark, I don't know if you have any insights from what you've seen in other states, but I do know in Wisconsin this was this was top priority for IPC, as you know, top priority for PSW, and I think pharmacists, a lot of the legislation that's come through, you kind of make reference to, is that pharmacists have been stepping up to whether it's vaccinations or injections, and a lot of other bills that have come through have been about how can we expand that scope of practice, how can we do things to pick up the slack, and especially at the for some of our members in maybe more outstate areas, it's such a crucial on the ground healthcare access point for many people and communities. So we're excited to see that.
Nick, I mean, you're well aware of, and I'm sure all of you guys are, we have shortages in the healthcare industry at every turn. And if we're going to, try to slot everybody so, with so much constraints within a certain area, it's going to make it difficult in the future to provide healthcare all around the state. I also worked on the remote pharmacy bill. I mean, it's another thing where we need to be able to help you guys out, to help you guys help your patients.
Yeah. Mark, anything to add on pharmacist services or anything like that you're seeing in around the country, or any feedback you've had on this type of legislation elsewhere?
Yeah, Nick, again, we've seen the really good momentum behind it. We have states like Ohio, Washington State, now Colorado, as well as Wisconsin. Representatives are really cutting edge of this, but we're seeing the adoption of these type of laws and regulations now allow pharmacists to practice more at the top of their license and get reimbursed for that. extra time with those patients. And again, I anticipate seeing this move across the country quite swiftly. We're seeing payers, Medicaid programs, and commercial payers very interested in the model, engaging pharmacists to and
Yep, we're losing pretty good there.
Yep.
Did
Mark,
you guys get the end of what Mark was saying there? I lost him a little
I
bit.
think we lost you at the end of that. Mark, you were
Okay.
saying that you see this type of legislation, kind of sweeping across the other states pretty rapidly, and that there's a lot of buy-in on the payer side for this type of partnership.
correct. Nick, can everyone hear me now? Nick?
Yep, you sound good.
Now we can.
Okay, not sure what happened there. Yeah, it's exciting because the scope of practice of pharmacy is expanding, and they're getting authorized to do more things. But importantly, state Medicaid programs and other payers, and now we're seeing commercial payers very interested in this model where we would get paid for consultation services, outcomes of patients, and documenting those successes. So yeah, I think Wisconsin was front of the line, but it's created fantastic precedent for us now to take it across the country, and not just in Medicaid programs, but with commercial plans as well.
Well, that's interesting. And Nick, could you maybe get me sort of a white paper?
Yeah.
On that? And
Yeah.
we're pretty much done. You're not going to introduce any new legislation now, but
Mm-hmm.
I plan on coming back. So
That's right. Well, that leads into my next question. But to follow up on that, one thing that we always want to do at IPC is because we are a nationwide network, we always want to be working outside the state, so we can deliver you that information here. And that's Mark, Jim, and I will be able to deliver that information for you and keep you apprised of the different trends and how this type of legislation is progressing through the states. But you opened up to a question that I'll have to ask now. So as we're wrapping up the session, we're in the mad scramble. There's just a list a mile long of committee hearings today, tomorrow in the Capitol. That'll continue as we get approach the end of session in the second week of March. What issues do you see as you approach? So for everyone on the call, Representative Murphy he's a state representative. They're elected every 2 years, so he will be out on the campaign trail this summer. What issues are you seeing that are top priority as you end session, and then going into the summer that you're going to be campaigning on?
Well, Nick, I'm on a lot of different committees, and I have a lot of legislation in a lot of different areas, and so I got to put on a different hat every day almost. I have some real estate legislation out there. There's some healthcare things. So it's pretty crazy. I have a credit union bill out there that's pretty big piece of legislation, and so
well we'll do you a favor and we'll deliver all the information so you can campaign on some pharmacy issues this summer.
That would be awesome. I would love to do that.
All right. Well, we will do that.
Yeah.
I'd ask too the group if anyone has any. If you have just time for another question or two, if we could open it up to the group, maybe share anything that they're seeing at the local in their stores that relates to state regulation, or any other question of Representative Murphy. And I can't remember if I mentioned in my brief introduction, but Greenfield area just outside of Appleton, for everyone on the call.
Mhm.
And
Yeah,
if
go
you do
ahead.
have a
Any
question,
questions?
just make sure you take yourself off of mute or feel free to chat in as well.
Well, if no questions, I do have just to leave you with this, because a big part of what we want to do in Wisconsin is make sure we're engaging our members and getting them connected with their legislators so they can deliver that constituent message right to them. Just wanted to hear from you, and of course this was Act 98 was a bill that was very important to pharmacists in your district. What's as a legislator, maybe describe the value of those contacts and relationships with the local leaders, local business
Oh my
owners
gosh.
in your community.
Oh, it's huge. It's huge. And I would say, the pharmacy community has done a very good job of keeping in contact with legislators. I mean, the people come down to my office and talk to me about their issues. And if they didn't, I mean, I wouldn't bring this bill. I mean, this isn't my idea. I mean, it's your idea, and it's you guys coming to me and convincing me it's a good idea. In this particular situation, it was pretty easy for you to convince me it was a good idea. I love the concept of saving money, of making sure that you guys are doing everything within your scope of practice that you can. So yeah, it's pretty easy. And I'll just give a shout out to Nick here, because I've worked with Nick for quite some time now, and we worked very closely on university issues in the past, and now the pharmacy stuff. And you guys are lucky to have someone who knows the ropes as well as Nick does, and so kudos, Nick.
I like that high note to end on. Thank you so much. But thank you, and really important to us. We'll be continue to reach out to you this summer. Jim, do I got you for a?
Yeah, I have a question for you,
Sure.
Representative Murphy. And first, thank you for carrying the water for the independents in the state and building momentum. It is very helpful as we were passing bills on the West Coast, which was my responsibility. Can you, for the benefit of the group, talk about the power of folks calling your office, emailing you, just getting in contact with you or your staff, asking you to support or oppose a bill? I think where some of this breaks down is folks think it's insurmountable and people, it doesn't matter their voice. Can you explain how powerful a pharmacist's voice is to you when you're weighing the merits of a bill?
Well, good question, Jim. And I have to say, a pharmacist, a professional person, their opinion carries a bit more weight than the average person in the public does. And I think anytime it's some kind of personal contact, whether it's a letter, a phone call, or a little bit to a lesser extent an email, those things really carry a lot of weight. You get groups that come out with these, sort of postcard campaigns. Those kind of things, legislators get, 15 postcards that are all the same. And, they kind of don't pay so much attention to that. Or if we get what I call program emails, where, you're getting the same email from everybody, you don't pay so much attention to that either. But when you get a local pharmacist who actually takes the time to dish you off a personal email, letter, or a personal phone call, those things are like, it's like a 10x type of effect that you get from that. So
Thank you. That's much appreciated.
you bet.
Yeah, well, that's a great message, and that's one of the things that we're going to be focused on is meeting you all out in your districts this summer, and getting engaged. So I appreciate your willingness twice to meet us after work hours, and I know you have
No
a big
problem.
day tomorrow in the Capitol. That being said, from IPC, thank you very much for joining us, and of course, thank you for your great work on Act 98.
You bet.
All right, thank you.
Great pleasure to be
Thank you,
with you.
Representative. Thank you very much.
Bye-bye.
So we'll do a little bit of an overview of Act 98 now with just so everybody is, I think, probably gathered it from the conversation. And Tanner, I just want to double check my slide is tracking now.
Yep, you're good to go.
Okay, great. Again, reimbursement for pharmacist services under the MA program. And I just want to give you a little timeline update. DHS needs to seek, as part of the legislation, a plan amendment from CMS, federal CMS. What that means for us is that the implementation of this is going to take a little bit of time. There needs to be a waiver, and they're going to also, on the front end of things, have an advisory committee. They want to kind of dial in what services are going to count, because the bill is written quite broadly. So that's going to go into what we call the rulemaking process. So I'm sure when you see somebody could tell me the three-letter acronym, the pharmacy, when the pharmacy administrative rules come out, you'll see some of that related to this bill. So the implementation timeline is probably end of the year in Wisconsin, but there will be a back billing date. So in the meantime, I think it's incumbent on pharmacists to ramp up for this. And I don't know if I had Jim teed up, but to talk about this a little bit, but did Jim hop off the call? Mark, you might be able to fill in. But this is, this is an opportunity, I think, under this legislation. And there's going to be some things that pharmacists need to ramp up via training, medical billing, collaborative agreements with physicians. I know Pharmacy Society of Wisconsin is going to be putting together like a template billing guide to help with those pharmacists that want to incorporate some of these services. But like I said, I know Jim was teed up. Mark, do you have any thoughts on kind of what a pharmacist is going to have to do to prepare to utilize this service, some of these services for reimbursement?
Well, Nick, I think we still have to kind of wait and see what the advisory committee comes up with typically. But one of the big challenges we hear across the country is how do you place this in your workflow? And you do it through the pharmacy practice management system, or do you have to have a separate software program that allows you to do medical billing? So there's still, we'll be providing a lot of education. We work very closely with PSW, and Sarah, I was on a call with her just recently on how do we get this so very successful. I think everyone agrees that education is going to be a big part of it. And then in addition to the educational piece, again, is just how do you, it seems that the other states, how do you adopt it into your workflow so it's still efficient? And that's, we're looking at different models around that. And, on the pharmacy side, Equip, it resides completely outside. You almost have to manage these patients, totally outside your pharmacy practice management system. Then on the medical billing side, you'll get CPT codes to bill for, any kind of reference to codes for office visits. And again, we will be providing education around that so that all the pharmacists that want to participate will feel comfortable doing so.
That's great. And so more information to come from IPC and PSW as this progresses through the rulemaking process. And I just want to give everybody a real quick heads up, but also then a caveat to kind of temper expectations. This bill was introduced at the end of March 2021, and the timeline that I'm trying to show here is that it kind of cruised through the Senate. It was passed through the Senate by the second week in May. Representative Murphy had the bill introduced in April, and it kind of bogged down over the summer a little bit, and it was finally passed and reported to the governor signed into law in middle of December. But I illustrate that while that might seem like it took a long time and there was a summer break in there, that's about as lightning speed as you're going to get in most cases on legislation. So this came together pretty quick. Other bills, for instance, PBM reform and different things that have happened over the years have taken a long time to get through. So this was one where I think we really won the day on messaging, and had bipartisan support, not a vote against it. You can see kind of just to show you who IPC is participating with in our lobbying support of this bill: Pharmacy Society of Wisconsin, Advocate Aurora, Medical College of Wisconsin. There's a pharmaceutical company in there, Walgreens, and others. So lobbying touch points, it's part and parcel to those that want to influence the regulatory landscape in Wisconsin. Did want to just run through a brief legislative session overview, and I think I promised Tanner we'd get you out of here at 6:30 at the very latest, and I want to stick to that. Starting the year, bipartisan budget, first budget in many years that passed with bipartisan support. There wasn't a lot of it, but it was signed by Governor Evers, and there were a few Democratic votes for the Republican crafted budget. Most importantly, though, Governor Evers had included some provisions that we maybe were not so crazy about in his budget proposal, including drug importation, PSAO regulation, and a drug affordability review board. Those are things that different sectors were not particularly crazy about, whether it was pharmacy or pharmaceutical or other healthcare areas, and those were all taken out at the joint finance level through advocacy. And it's just important to know that these things are always on our radar, and we're always being mindful of what's out there that could impact the industry. Obviously, in this session, COVID, vaccines, unemployment were the big messaging points. We're now at the end of session, kind of again looking at unemployment. We're looking at election security or election witch hunts, depending on how you view that, and education policy. So those are kind of the big things that are bubbling up right now. Again, like I mentioned in the conversation with Representative Murphy, the legislative session is scheduled to wrap up in the second week of March. And as some of you know, it's been all over the newspapers, redistricting. It's a redistricting year in Wisconsin where they rewrite the maps, and there's an update on that. Those are going to be written by the Supreme Court, and they're going to adopt minimal changes. So not a huge shakeup, in my opinion, is on the way. Other bills that pharmacy-related successes: Wisconsin Act 9. This was the pharmacy benefit managers reforms. There was a lot of pieces to this bill. I mean, this was a kind of hard negotiation. I think we're pleased with some of the. If we're looking at how does this really help in the day-to-day, we're excited to see what kind of progress we made on pharmacy audit protections. That's kind of a big piece of that. And then we're also getting PBMs registered so that they're now going to be subject to, under OCI, the Office of the Commissioner of Insurance in Wisconsin, for regulatory oversight. And just to kind of follow up on the points that Jim and I asked Representative Murphy on the impact of local leaders and pharmacists reaching out to their legislators. There's over 100 co-sponsors on that bill, and that was because of a robust campaign to get pharmacists reaching out directly and building relationships to their legislators over the summer, and that's what we're going to try to reactivate this summer at IPC. I should also note that there's a PSW has put together a PBM complaint guide. There is a complaint process now that they're regulated. I think that's been sent out to everybody, but I'll make sure that that's forwarded out again, just because this is the first time that there's been a governance structure, a regulatory structure in a place to go when we're seeing problems in that area. Some other pharmacy. Oh, go ahead.
Nick, I should have raised my hand, I guess. But I want to just add on to that, the Supreme Court ruling in Rutledge. It's so important now that we were able to get this law in place, Act 9, because in the past, PPM always said, it did not apply to certain populations. And now we know that that in fact these PPM regulations, even those that are not just price related, are likely going to be upheld by the court systems as well. So we've really taken away one of the major communication points that PPM have had over the last 10, 20 years. They'd always run up to the Capitol and say, we can't do this because it violates ERISA or violates federal law, and taking that away from them. And so we're starting to see this again across the country as well.
Yep, great developments on that front, and yeah, that's a great point, because it takes us from being a very narrow, a narrower issue that the PBMs might have described, and brings it up for more opportunity in the future. I'd move on to a couple other pharmacy-related legislation pieces. Wisconsin Act 3, pharmacy technicians and pharmacy students administering vaccines, registration of pharmacy technicians. I believe those rules are going to be finalized in the next 6 to 7 months or so. They're behind schedule because of COVID over at the pharmacy board. Act 101, licensing and regulation of pharmacies and remote dispensing sites. These are just laws that passed. These are not, IPC did not, opted not to engage on that. Some other legislation that's come through, permitting pharmacists to prescribe certain contraceptives. That was actually an issue up in the Green Bay area. The Green Bay representative that seems to be still available to potentially move through the pipeline. And then kind of the biggest fight in the state capitol right now, you may have heard of, is on the issue of white bagging. This is, you've got providers and the hospitals lined up on one side with the patients, and they're fighting against the white. They want a prohibition on the white bagging practice by insurance. I would say the insurance and employer community have rallied a very strong defense on this issue. Mark, you might be able to share what you've seen in other states on white bagging, but as we approach the end of the session, my guess is that is not going to be signed into law. I wouldn't expect the Republicans to lob a bill like that to Governor Evers to campaign on in the summer. And there was just a very, very strong defense on the argument that hospitals had been really marking up drugs when they're doing a clinician administered drug, and that white bagging helps contain premium costs. That's the debate. That's the argument that's going on right here. Mark, I don't know if you have any insights on how white bagging the white bagging issue has been dealt with in other states.
Yeah, Nick, we're seeing it come up quite frequently, especially last year or two. And you're absolutely right. It's the hospitals and the insurance companies, PBM, to speak about the economics behind it. But providers are starting to take a stronger approach with it as well. And I actually think the provider community is starting to make some headway. Maybe not in Wisconsin this session, but that's across the country. They are starting to get some traction around that, and we generally think this side. Right?
Okay. A couple of the other things we're seeing out there, copay accumulator. That's a patient-focused and pharma-focused bill, application of prescription drug payments to health insurance cost savings. So that copay accumulator, Mark, I'm sure you've seen that running through in a bunch of states. And then Assembly Bill 745, prohibiting step therapy protocols for certain cancer drugs. Again, patient-focused bill. There was a step therapy bill that had passed last session or a session ago in Wisconsin. I don't anticipate that bill to move this year, but just wanted you to be aware of some of the other big bills that are out there that you may see that you may see and may end up impacting your day to day. Just quick update. This is maybe a little dated now, but the OSHA COVID mandate was overturned, was blocked by the Supreme Court. However, you might, for those of you that work with others that are in facilities participating in Medicare and Medicaid in 24 states, and I don't have a list of those states. Mark might have it. Employees that mandate did still take effect, and actually by next week they have to have the first dose, and that's strictly to those federally funded healthcare facilities. There are, you might see in the news, there's a series of COVID vaccine, protections against mandates, or however you want to say it, prohibiting businesses from discriminating or based on whether someone's vaccinated or not. These bills are going to move through the legislature. They will get vetoed by Governor Evers. This is kind of a campaign positioning bill. So they might gain a lot of attention in the news, but they're destined. Governor Evers has already said he will veto those bills. So I just want to make everyone aware of that in case they see that in the newspaper and wonder why I didn't bring it up. Actually, I'll stop just right there. If there's any questions, please let Mark or I know on any of the legislation. You can use your chat feature if you have a question to ask, or just chime in. Otherwise, I'd point out, I'd just kind of jump into where we are, just give an overview of what's going on. We're going to be approaching later this year, the state budget cycle. What's interesting here is, of course, there's a gubernatorial election. Governor Evers is up for re-election in November. So it's to be determined who's going to be writing the next state budget. But this slide just kind of shows where we're going to be in the process. All the big action is going to start when the budget starts being drafted. That's when good ideas and bad ideas pop into the big spending bill for the state. And that'll be the focus of the beginning of the next session. So legislators and the governor are going to be out on the campaign trail all summer. And then we're going to come back and deal with the budget right away, and likely to be signed into law one way or another by July 2023. And speaking of that election preview, this could be a very tight race in Wisconsin. Presumptive Republican nominee will be Rebecca Clayfish, the former lieutenant governor. That does have a primary opponent in Kevin Nicholson. They're both going to be very well funded. For those of you that follow political races often, this is one of those situations where having a primary opponent is probably going to be to her Rebecca Clayfish's detriment. I think she's probably going to have to fight pretty hard, because this is Kevin Nicholson is going to fight her and challenge her that she's not conservative enough, or that he's against the establishment. So that's going to be a challenge for Rebecca Clayfish in the primary. It's going to enter the likely she will emerge from the Republican primary, where I think Governor Evers, if national polling trends hold, Governor Evers is going to be in a tight race with Rebecca Clayfish. Senator Ron Johnson just announced recently that he's running for re-election. Current Lieutenant Governor Mandela Barnes is leading in fundraising on the Democratic primary side, and profiles as the likely opponent for Ron Johnson in his re-elect. And then just kind of big picture right now, the general polling trends. General polling trends are favoring Republicans, and that's very common with whoever's in the presidential office usually favors the other party in the midterm elections. We're seeing that a little bit, but there hasn't been a lot of updates to polling in Wisconsin. So again, Tony Evers has started out very high at the front end of COVID. His approval ratings have declined along with President Biden's in Wisconsin. So again, leading to probably a tight election. The other kind of landscape piece in Wisconsin is strong GOP majorities in both the Assembly and Senate. I don't see redistricting shaking that up. Whether Governor Evers comes back, he's very, very likely going to have to deal with the Republican legislature again. And that's okay for IPC. I think we've been, as we showed this session, we've been successful in that environment as well. Talked about the polling trends a little bit, but this is from later in the fall. Just what you see with Governor Evers' polling trends. His approval stands at 45% with 46 disapproval. This is trended down where he was earlier in the summer. He was at 50% approval and 43% disapproval. And of course, I think concerns with the economy and everything else going on. We've got 41% of the people only thinking that the state is headed in the right direction. Of course, we're dealing with a purple state, so these numbers aren't all entirely surprising. Again, just a little profile of the governor's race. Governor Evers and Rebecca Clayfish, former lieutenant governor. She just a note: the party of the sitting president has lost the last 8 contests for governor in Wisconsin, a streak that has lasted more than 30 years. So that is there's some history that Governor Evers is going to be trying to overcome in his bid for a reelect. Talked about Republican majorities in both state houses. New Senate Majority Leader this year is Devin LeMahieu. For any of those that are on the North Shore area in Wisconsin, first time Majority Leader replacing Senator Scott Fitzgerald, who at times was a friend of IPC's in the past. He's now a congressman, and I would expect Devin LeMahieu will be back next session. Speaker Robin Voss, longest serving speaker in Wisconsin history, has really helped build a very strong Republican majority in Wisconsin. Sooner or later, he will step down from speaker, and I think Democrats in Wisconsin will be excited about that because of his track record of success. But there's no timetable for that at the moment. Just leave this slide up. I won't run through everybody, but if this is in the area with anybody on the call, take note. There's several legislative or a lot of legislative retirements occurring this session. So with that being said, I'll kind of pause there. Jim, Jim's texting me. Excuse me. Mark, do you have any questions or anything about the political landscape, or anybody on the call on what we're seeing? Of course, after this session ends in March, legislators are going to hit the campaign trail for that November election. So that being said, that kind of leads into the next steps piece, and that was another one that I had Jim teed up for. So I'll kind of wing it, but Mark, jump in here on how we can on your thoughts on how to best engage our IPC members. So legislators will be out on the campaign trail this summer, and this is where we really want to develop that in-district constituent pharmacist to legislator relationship. They'll be out. They'll want to hear from Main Street. Mark, any successes or thoughts on that, or should I kind of jump into the next steps on it?
I would think that we have an opportunity this year in going next session. I think will make a difference. And representatives have indicated, picking up your phone and having a discussion or even better, inviting your elected officials into the pharmacy and show them, what's important role you play in your local community. That is needed. And we've literally seen legislators voted against us time and time again. Once you're able to demonstrate to them that local community presence that you have, it turned them on a dime. And we can almost count on them every single time to support our bills. So it's very important. We're going to be doing more outreach to our members in Wisconsin. We talked about Westwood, how important that is, and Levy, which is a follow-up to North Dakota. Looks like a circuit probably is going to grant an inbound hearing around that. I'm surprised to do. And so, the momentum from a legal perspective, from a legislative perspective, it's all aligning for community pharmacy. Literally, the best I've seen in the 3 decades that I've been at work, advocating for community pharmacy. It is now. And so you'll be hearing a lot more from us in the next few months. We do want to make sure that our members get engaged.
Well, that's well said. So we'll be, like Mark said, we'll be following up with more member engagement opportunities, and we'll be setting you all up for information and some 101 on how to build a relationship with your legislators in the near future here. And we'll always keep you apprised on what's going on, especially on follow-up for that Wisconsin Act 98 to make sure that IPC members are positioned to take good advantage of that. And here we are, it's 6:30 exactly. Promised I'd get you done by now, but happy to answer any questions. Feel free to type them in or just jump in and ask away. Happy to open up for a little Q&A to end. Well, hearing none, I assume this was, I think this was a great success. I'm very excited to be able to get this message out to IPC membership. Tanner, thanks for setting it all up and recording it. And we'll be happy to direct any questions about the presentation to me. Tanner, please share my email address with the group, and we'll be in touch.
Yeah. Thank you again, Nick, and thank you everybody for attending. Mark, appreciate you hopping on and chiming in as well. Again, if anybody does have questions, please let me know. I believe everybody on the call should have my contact information by now with 3 or 4 outreaches regarding both calls. So, but yeah, thank you again, Nick, and everybody for attending.